Welcome, everyone, to our NCAA social series dealing with COVID-19. I'm Andy Katz. Pleased to be joined by Dr. Mark Emmert, the NCAA President, and Dr. Brian Hainline, our NCAA Chief Medical Officer. So, Dr. Emmert, this is week 7 of us doing this social series, but it was 8 weeks ago. It's kind of crazy to think like that, but it's 8 weeks ago that all this just came crashing down. That first 24, 36, 48 hours, what was that like for you?
Yeah, it is hard to imagine that it was 8 weeks ago. It's been very, very peculiar for everybody, of course, during this time frame. When we made the decision, and we can talk about that, the dynamic of that a bit if you want to, Andy, of course. But when we made the decision, we, meaning me, the Board of Governors, with the advice of all of those around us, we knew that we were making the right choice. So there was no uncertainty about the decision, but the hard reality after you make the decision and after you make the call of what that is really meaning in the lives of so many people, that was the hard part that settled in as we moved through those next few days. There was a mountain of work to be done by Dan Gavitt and his team and Joni Comstock and her teams to begin to unravel just the logistics of championships. And, we had a ton of things to do, starting to sit down and look at all of the implications of this. But the part that was most painful and most deeply felt was the human impact. I on Friday the 13th of all days, the day after we made the call, I had to talk to coaches. So I just picked up, I had to, for my own mental health, I just picked up the phone and, called a handful of coaches just to talk to them and tell them, how bad we felt about having to do this. I called the coach of Dayton. Here was the Dayton Flyers on that amazing run. And I couldn't imagine what it was like to sit down with those kids and say it was over. Or, I called the women's coaches at Maryland and Oregon and chatted with them and Michigan State and Gonzaga. And I just people that I know and have a relationship with to see how this was settling in, to see how their kids were responding and dealing with it. And just to make sure that we were doing anything and everything we could to support these young men and women.
So all those decisions, and we don't have to go through all of them, I'm just curious in terms of everything coming to a grinding halt. And at that point, we weren't initially sort of, banned from going to certain buildings and things of that nature. It was all initially just the large groups together. What was it like to have to unravel all of the planning and basically cancel vendors and, arenas and facilities, all those things that take years to set up, all had to be basically canceled within a few days?
Yeah, it was a pretty dramatic few days for the staff. I was just, and I remain, Andy, just incredibly proud of the whole team in the NCAA National Office and the committees too that worked on this. The men's and women's basketball committees obviously were right in the throes of putting together their selection processes, and so they were getting information from us. Danny Gavitt and Lynn Holtzman were working with them and doing everything they could, and everybody just shifted gears and said, okay, we made the decision. This is awful, but now we got to get on with unraveling it, as you say. And so, yeah, canceling out all the hotels, dealing with the travel plans and all the vendors and backing that all out. And then, of course, within another day or so, we, as you know, made the decision to also cancel all the spring championships. So then the same thing started all over again, but with another 20 or so championships for the spring. So it was a very, very hectic, just full week, really, of trying to get all of that wound back up. And then we're still doing some of it, of course, because they're complicated arrangements with all of these vendors and all the hoteliers and all the travel agencies and the charter travel and everything. So it was, I guess, therapeutic to have a ton of work to do immediately after a very gut-wrenching decision like that. But it was done really well. Everybody threw themselves at it, worked very, very long hours, and we're in a good spot today, given all that happened.
So Dr. Hainline, at that same time, take me through how that advisory panel was put together and brought up to speed about what needed to be done in terms of the medical health and safety decisions at the same time?
Yeah, so, the advisory panel was a nice cross-section of individuals looking at public health, global health, infectious disease, our membership, competitive safeguards, and a security expert. So, it's interesting. It seemed like maybe one or two steps ahead of everyone else. They were, one person was inside the CDC on a regular basis, another with Health and Human Services. And so it was just on a daily basis saying, okay, now we did this. What's the next step? What's the next step? And really just trying to understand this pandemic because, at the time we had very little scientific information. It was the papers from China were just starting to be published. We had unofficial data from Italy, but we didn't have any academic papers coming from Italy. So they were all scrambling and trying to just stay a little bit ahead of the game. So we could get good guidance from them. So it was a really intense time with the advisory panel.
Dr. Emmert, one thing that we didn't have to deal with in that immediacy of those couple days was a student athlete who, at least publicly, we still don't know, maybe someone did, but publicly had tested positive, the way the NBA had to deal with that with Rudy Gobert first. And then obviously that created a whole, avalanche of decisions for Adam Silver in the NBA. I mean, how concerned were you as these conference tournaments were going on in those first few days of that week that we were going to hear of a case like that?
Well, we were deeply concerned about it. And of course, that factored into the decisions, as Brian and the advisory team were working their way through this huge medical uncertainty. But we were all, we were listening to them and also watching all of the data coming in from around the country. We're having some states beginning to make some decisions. Ohio, if you remember, made a very early call in all of this. And it was clear that this was going to be a very jolting event, but hard to predict. And then when you get Rudy Gobert's case, that obviously was just another important data point, but it just reminded us that very healthy, strong athletes can get this too. And we have many, many more athletes, obviously, competing than the NBA or another professional sport league. And we move them all over the country. We move them on very short notice. And all of a sudden, the probability of infection shot up in our minds. And that was really critical in making the call to stop the tournaments.
All right, so let's spin forward to where we are now and obviously where we hope to get to here in a few months. Last week after we talked, Dr. Hainline, the core principles of resocialization of sport came out. What do you want people to know from that are maybe the most important critical points of that document?
Well, I think there are three really important points, Andy. One is that this is a phased-in approach. So this isn't like a national red light, green light, and all of a sudden now it's a green light and everyone goes out and does what they want. It really needs to be carefully planned so that we understand that people can do the right thing and that the infrastructure support is there. So that's one part of it. The other is that there has to be a good sense of surveillance. And that really has to be at the campus level, the regional level. So if we're going to start opening up society, we need to know what that means. And that's what surveillance is all about. So we need to improve the infrastructure for that. And then finally, the testing is going to be really important. And, this is what I'm discussing all the time with my counterparts in like the NFL or the NBA and other sports. So what does testing really mean and how often does it have to be done? Especially if you're in a contact sport where the athletes are close to one another. So the testing component, especially getting a rapid diagnostic test on the one hand and then understanding immunity on the other, that's going to have to really improve over the next several weeks. So those three parts of the document are really critical if this is going to be rolled out in a manner that's successful.
So, Dr. Emmert, you actually can straddle both worlds because you talk to presidents that need to have students on campus before student athletes can compete. So it's both the regular student body and the student athlete population. What are you hearing from presidents about ways in which they can get students safely on campus in the fall?
Yeah, it's the most important question, Andy, because of course college athletes are college students, and you can't you can't have college sports if you don't have colleges open and having students on them. You don't want to ever put student athletes at greater risk than the rest of the student body. So everybody's very, very well aware of that. I've probably talked to, I suppose, 100 presidents over the past 6-7 weeks around the country, big schools, small schools, publics, privates, all over the place. And there's anxiety, as you'd expect, because of the high levels of uncertainty. We need the systems in place that Brian was just outlining before we can have the appropriate level of testing and the appropriate levels of being able to track and deal with any outbreaks that occur. But at the same time, they're exploring all of the options. So if I had to describe a typical presidential thought process right now, they're all looking at maybe 3 scenarios. One where you move towards something that looks like normal campus behavior with some additions of sensible things, social distancing and all the sanitation processes you want to take, and figuring out what they can and can't do with residence halls, but trying to think about it as a fairly typical school year. The middle ground is then some kind of hybrid where you look at those places where the social distancing may not work or may not be possible. So you think of large lecture halls. I was president of Washington. Washington, it's not uncommon to have a 200 student lecture. So can you take those courses and move them online and deliver those kind of courses in a unique hybrid fashion, and then still move toward the laboratories, the studios, the other small seminar models where you really need face-to-face interaction, but you can maintain social distancing? How can you make that work? And then the third one that they're all trying to avoid, because they know it's not what students want, but may be necessary, is what does it mean to go back all online? They've all had a good experience, well, a healthy experience with it this spring, as they've struggled to move from traditional classes to online in a matter of days. And now they've had more experience with it, and they all know they can do a better job of it. But they're gaming all those scenarios out, all 3 of them. How do you game plan for those things? And then they're going to continue to watch the evidence, listen to their state and local health officials, and of course see what's going on at the national level.
So, and this is for both of you, and maybe you can start with you, Dr. Emmert, and pick it up, Dr. Hainline. So many different states are on different tracks right now. Some are opening up more than others. Some aren't open at all. And we're seeing plenty of statements from university presidents, plan to, will, all this sort of catch keywords of hoping to be in person in the fall, and some going further than others. What happens if we don't have uniformity across the country, and some schools are open, the full, some have the hybrid, and some not at all?
Well, I think we should assume that's going to be the case, Andy. It strikes me, and Brian's the expert here, obviously not me, but it strikes me that it's very unlikely that we'll reach a place sometime this summer where everybody feels equally confident and equally comfortable, because this is so differentiated by geographies and urban density and a whole array of different demographic variables, that the level of confidence is going to vary from campus to campus. And those have got to be local decisions based upon the best available evidence and data that they have in front of them. So it seems to me that we will see some schools in maybe all 3 of those scenarios that I described. And that has interesting implications, of course, for intercollegiate athletics. All the various member committees and the conferences are all talking right now about what does it mean if we have that sort of scenario where we've got different opening times or different opening models. What does it mean if we have to, if you look at a conference, for example, if a conference has some schools open and some not, you can't run a regular schedule. What does it mean if you've got that scenario? How do you adjust all of the rules to provide as much flexibility as you possibly can do to let student athletes have a good experience in that season. First and foremost, we're going to go back to our priorities. Got to keep student athletes and all students and their staffs and the coaches and everybody around them healthy and safe. That's got to be, the number one priority. Then you got to say, okay, what can we do to make sure they have as good an academic and athletic experience as we possibly can? And if you've got to relax a variety of the regulatory regimes that are in place around how many games are in a season, can you play the same opponent more than once, all of those things, then fine, let's figure out how we can relax those. Let's keep our priorities in place and recognize this is going to be a very unusual school year, and we just have to make the best of it.
Dr. Hainline?
Yeah, just picking up on that, I mean, it's sort of two decisions have to be made. One is we aren't going to have one sort of national time when everyone can start preseason. So there's going to be a little bit of inequity there, if you will. And so, but that already exists to a degree in college sports. The southern schools can start some sports earlier than the northern schools. And if you're out west, the mountain, and there's wildfires, they might not be able to train for a couple of weeks. So that's going to exist. But getting back to President Emmert's point, the most important thing is what's going to be the minimum amount of time that's going to be necessary that you have to be in preseason, for example, before you can start football. And so what's happened is there are a number of committees. There's a staff committee, which is multidisciplinary, and then we're working with competitive safeguards, football oversight committee, men's and women's basketball oversight, and the competition oversight committee. And we're developing all of the what if scenarios. And to President Emmert's point, it requires being nimble and sometimes liberal in the interpretation of rules and regulations and bylaws, so that, we may have to change them, but then there's always going to be this minimum requirement for what is it going to take to get an athlete out there safely. And so one of the risks would be, if you look at a sport like football, is that we begin the season too quickly, and then you're at risk of musculoskeletal injuries or other sorts of injuries. So I think that's where you're going to have uniformity, that there's going to be a minimum requirement for the amount of practice and even the amount of competition that's necessary before a championship.
So Dr. Hainline, I want to start with you. What happens if states, schools, and especially conferences aren't ready to start on the same date? How does a national organization like the NCAA maintain competitive equity? If I'm understanding you, Dr. Hainline, does that mean that you still have to have that 6 weeks, if that's what it ends up being, of preseason practice before you can compete in games, even if that means one league is starting a month before another?
Well, that's where we are right now. So in working with the American Football Coaches Association Football Oversight Committee, and they actually worked out a 4, 6, 8 week scenario. None of it's written down and none of it's in stone right now, if you will. But they're thinking that there is going to have to be a minimum amount of time. And so right now it's circling around that 4 to 6 week mark. And so you wouldn't be able to shorten that. So yeah, that's where there's going to be some differences, I think, that will play out regionally.
So in terms of the fall sports and winter sports, where the NCAA does have complete control versus, the conferences with the football playoff, soccer, for example, Dr. Emmert, does it still apply that if school X is ready in mid-August and it's determined that you need whatever it is, 2-3 weeks to prepare for soccer, and then the next school isn't ready till September 20th, do they then have to still have that 2 or 3 weeks before they can compete in that particular sport?
Yeah, the issue is, as Dr. Hainline was saying, is got to be built around what's the minimum necessary time to have a young man or young woman be physically ready and mentally ready to compete again. They may well not have as much time in game plan prep or in skills development or a variety of other things, but this is first and foremost, it's got to be, are they healthy to compete? And if the answer is they need, I'm making these numbers up, they need 3 weeks in soccer to get ready, it doesn't matter what the competitive issue is going to be here. They need to put in that amount of time before they can safely compete. That's got to be the the critical variable here. And that's what I meant when I said, this is going to create some inequities. Brian said it too. And we would much rather relax some of those competitive equity issues than ever put a young man or young woman at risk physically or mentally. So those are all plausible scenarios, Andy. We hope that's not the case, of course, and we're all assuming and trying to make sure that we can move forward simultaneously. But again, I think it's unlikely that everybody's going to be in the same place at the same time, and that will create some of those difficulties.
So what are the chances also of relaxing the practice restrictions if some schools, and I know it's going to be a very minority, if any, bring their students or student athletes on campus this summer, whether it's mid to late July or even earlier August, and others don't? And then in addition to that, if it's that extreme scenario of the third one that you pointed out, Dr. Emmert, where there is no in-person class in the fall, yet, universally, but yet some schools are, and their athletes are on campus, what are the chances that that practice aspect, could be relaxed as well, that in October, November, they could at least practice, even if there's no games across the country?
Yeah, first of all of the in Division I for sure, all of the commissioners and every president that I've talked to is in clear agreement. If you don't have students on campus, you don't have student athletes on campus. That doesn't mean it has to be up and running in the full normal model, but you've got to treat the health and well-being of the athletes at least as much as the regular students. And so if a school doesn't reopen, then they're not going to be playing sports. I mean, it's really that simple. In terms of flexibility around practices, that's part of the discussions that are going on right now among all the members. Brian's deeply involved in those conversations, and again, from my point of view, and I know from the advisory group's point of view, this is all about health and safety. If we're going to relax on something, it's about competitive fairness. It's not, but we're not going to relax on health and well-being. That's got to be front and center right now in every decision that's made. Will that mean that some school doesn't play as full a schedule as another school, and that may create some inequity in their ability to participate in the championship? Possibly, and we'll have to cross that bridge when we get there. But you build everything around safety.
Yeah, I mean, those kind of problems are good to have if we have to decide.
I'll be delighted to have those debates later in the fall.
So the fan aspect, which clearly is probably the last part of this. First, it's students on campus, student athletes being able to compete, practice and compete. And then we get to fans. I've seen all different comments from presidents, ADs about, well, if it's safe, safe enough for student athletes and students to be on campus, why wouldn't it be safe for fans? Problem, of course, is you've got 10,000, 15, 30, up to 100,000 fans in some of these football stadiums. So, Dr. Hainline, help us here understand the difference between a community of student athletes and students versus now bringing in fans from around the community, around the state, around the country to an event.
Wendy, it's always about having a sense of control of your environment. And so if you're just talking about student athletes and you have the athletic trainers, the team physicians, the coaches, they've gone through all the different scenarios and they have a sense of control, they have a sense of contact tracing. Once you bring fans in, you're bringing in this whole other element and potentially where you don't have control of the situation. And it's potentially a public health risk. So I think just like we're staging things where, first the student athletes are coming in 10 at a time and then maybe groups that are larger, you would want to take that same approach for fans because you just want to make certain that from an infrastructure and public health point of view that you can support what you're doing. And I think I mentioned before, and so, one event that I'm advising on, the U.S. Open Tennis Championship, it's the single largest annual sporting event in the world. Do you hold that? And can you hold it with fans? And so you play out all of these what if scenarios. It's the same sort of approach we would take to, say, a football game. And, initially the thought always is just have the essential personnel and then you build from there, and you would start with a much smaller fan base. And if you can support it, well, then you continue to progress.
Dr. Emmert, where are you on where the fan aspect of this fits in?
Well, the same place that Dr. Hainline is. We're going to rely on, and everybody should be relying on their medical and public health experts to advise folks. We're going to have to wait and see what local and state, and to a certain extent even federal officials are going to allow in terms of gatherings. But just because there's some regulation that's been lifted doesn't mean that automatically means you should immediately put 105,000 fans in a football stadium. I think that the proper thing to do, the sensible thing to do, is to do this phased approach that Brian and the advisory team are talking about, and indeed the federal government's been talking about, where you can begin at one end of the continuum and work your way along. So it's plausible to me that early in the season, let's just stick with football, you see very, very limited fan access, but by the later in the season, as things develop, hopefully in a very positive way, you all of a sudden can see larger fan bases attending. It's not clear to me socially where communities are and whether or not 100,000 people are ready to go sit in a stadium side by side quite yet. That's the other piece of this is, making sure people have choices that they can make that they're comfortable with. And that's got to play on a little bit. And then the other scenario that we all are nervous about, but we certainly have to think through, is what if we have an outbreak? What if there's a flare up in a community on a campus? What do we do then? How does the campus handle it? How does the fan base handle it? What do you do with your student athletes? We've got just a little bit of time to think through all of those scenarios, because that too is certainly plausible with 1,100 NCAA schools, 19,000 teams, 500,000 student athletes. The arithmetic is not in your favor if you think you're not going to have any outbreaks in that cohort. So we're working through all of these scenarios, bringing the best medical advice and public health advice we can to bear, and then helping the schools and the conferences make decisions accordingly.
One last topic, Dr. Hainline, are masks. And obviously more states are making it mandatory or suggesting that we all wear masks when we're out in any kind of public setting. How does a mask translate to the field of play, to the court, when you're competing right next to each other, but can't really breathe in a mask, but also you have officials, coaches, stat crew, media? I mean, how do you see the whole mask aspect playing out over the next few months?
Well, I think initially, Andy, especially in phases 1, phases 2, everyone's going to be wearing masks. If you're in a situation, and it's just like even in New York today, our Governor Cuomo says, well, wear a mask if you can't physically distance. And so, if you're doing workouts that are really spaced out, I can see a scenario where people aren't wearing masks, just like in the streets of New York. Not everyone is, if they can really be spaced out. But once you're in that place where you're close and you don't have that sense of control in phases 1 and 2, I think you're going to be seeing people wearing masks. As you move into phase 3, if we're comfortable from an infrastructure point of view that we can support that, well, that's when the masks start coming off, and that's when there's the physical contact, and that's a whole other level, where we have to, again, measure, can this be rolled out safely? Can it be rolled out properly? So I think it's around that phase 3 that you're going to see the masks going away.
And Dr. Emmert, from you, how confident are you that the testing and tracing that we've been talking about will really more likely lie at the feet of these universities across the country rather than rely on the local and federal government?
Well, everybody in the public health arena and the public policy arena is working hard, I believe, on the testing issue. And as again, Brian could describe much more effectively than me, the testing is multi-phased. There's a lot of issues around it, but we certainly need to have a much higher level of testing. If you're going to have contact tracing, you've got to have higher levels of testing. The details around the frequency of testing, how that's going to work with point of care testing, is going to be determined. What we know is we've got to throw as a nation a lot of resources at that right now. You can't simply turn to a university and say, well, you got to figure that one out on your own. That doesn't work. There's plenty of our member schools that are also the leading medical universities in America. They're deeply involved in the testing and the vaccine development and the treatment development, but they don't have the resources to say, okay, you're now bringing 30,000 students back to campus. We're going to test everybody right now. No one has that capability today. We need them to get there. We need them to get there fast. And that's a big challenge, but I think it's doable. I'm cautiously optimistic. And we do have a lot of people and a lot of resources being pushed at it, but it's a long way off too.
And finally, Dr. Emmert, when in June or July or even early August, do you think these schools and conferences will have to make a decision about any kind of competition in the fall?
Well, again, first and foremost, it's going to be up to the schools about whether they're bringing students back and under what model. Many of the presidents that I've been talking to and just thinking of my own time as a president would find it very difficult to push that decision much further than middle or end of June. So I suspect that people are going to have to make decisions sometime during June, maybe by the 4th of July, based upon the best available data at that time. There may be an opportunity to delay it a little bit more, but gosh, you've got a college age child. They're going to be wanting to go off to college right after that. If the model doesn't work, pushing it later than the 1st of July is pretty light.
And Dr. Hainline, on that timeline?
No, I think that's right, and it's the same thing for athletics, and because right now the assumption is that the dates of the championships, they're set. So if you do the math and you work backward, it would be hard to push athletics back to, a decision past the first week of July.
Dr. Mark Emmert, NCAA President, and Dr. Brian Hainline, NCAA Chief Medical Officer. Thanks again, as always. Believe it or not, week 7 of our NCAA social series dealing with COVID-19, always incredible, educational, and informative. You can go to ncaa.org/COVID-19 for more information on the subject. Stay safe, everyone.